how do you use CPT with fill in the blank? So I know this is a question you actually get quite a bit. Why is there no CPT manual on, CPT for specific, sexual abuse survivors, or for childhood abuse survivors, or for physical assault, or for law enforcement? Can you speak a little bit to that?
And I hate to sound trite because I've said it before and I don't mean it, but I always say, because it's in the book, right? So what we did is we had spent years with Patty Rezick, the original developer, doing rape victims, and then me doing childhood sexual abuse, which of course, any of you out here who do child sexual abuse know that it doesn't stop there. It becomes adolescent rape and then domestic violence. So they don't come to me with just a single incident rape from mom's boyfriend, right? Ritualistic child abuse. We get all of those things. And then Candace Munson coming along and doing some veterans work. And then all of us being, given referrals about car accidents and natural disasters and Hurricane Katrina. And what we started to realize, and I was even fearful when I left academia and went to the VA, I can't treat a veteran. I'm a sexual abuse expert. And what I realized, the first veteran that sat on my chair, it's the same thing. Because we're still talking about that same alteration in the prefrontal cortex, and we're still talking about impact in those main thematic areas. And to be honest, CPT is a really individual therapy. So I'm looking at where they're stuck. I'm not pre-assuming I know. It's all for them to kind of help me figure out where cognitively they're gotten stuck in terms of telling themselves things that aren't accurate or that impact their life. And I always say a stuck point is any thought you have that leads to a painful emotion that won't go away. Wow. I mean, that leaves us open to anything. Any thought you have that leads to a painful emotion that won't go away. So I can be talking about literally anything. And it's just them to say, where are you hurting? And me to say, what are you telling yourself that leads to that pain? And giving them the tools to figure all of that out, right? And then be able to do that going forward. And so at this point, I don't think there's any type of trauma I haven't treated, from first responders to veterans to abuse to ritual to trafficking. And I can tell you, it really doesn't matter. And in fact, at this point, I could have them not tell me at all what the traumatic event was, and it wouldn't change a single thing about what I would do. And so I think more to the point is for the therapist to be non-judgmental, to be, to not assume what trauma got to them, because we just don't know. It could be any of them, but to really be willing to look at all the traumas, figure out which one caused the PTSD, which ones have just supported it, and then work through all of their disruptions with them throughout. And then what we did is we put special information in the book and in the training. I have to be honest, in the training, we go over a lot of this about what might I do if I'm dealing with a first responder? What might I do with someone who's working in a situation where they can't get out of their trauma and they're constantly being re-traumatized, an adolescent living in a very difficult group home? What are you going to do differently? Because those are key things, but the protocol stays the same, right? Does that help?
Yeah, I think so.